So David, thank you for sitting down with me and just chatting a little bit.
That's great, Jeff.
You've been kind of in this mobile space for quite a while.
Yeah.
I don't want to, talk about how long, but you and Judy Brown, it kind of been around since the beginning, right? And I'm sure that you have some wisdom, some observations you can probably share with us. It seems like we're really gaining some momentum right now.
Yeah, the whole world has changed since the iPhone and Android and the proliferation of the smartphone. Reaching 1 billion smartphones is changing the dynamic too.
Yeah.
Even before that, though, some of the lessons learned even back from my NASA days in the mid-'90s when we first started doing some of this still hold true.
Yeah.
About the way that you have to distill information down for mobile, the way that you have to be a good information designer as well as an instructional designer.
Right.
And I think really the power of messaging hasn't changed either. We may have added some nice new features and things like that, but at the same time, a lot of the core fundamentals of what people have always used for communication delivery to each other and from machines and from other systems has stayed consistent. So
absolutely.
That's what we can continue to take even from my first mLearning book, and now as I focus on healthcare a little bit too, from the mHealth book too. We're kind of seeing those same trends.
Yeah. Well, I've kind of said that mobile kind of forces good instructional design in a way, right? We have to kind of think about, the basics and how to really shape things properly, and so it forces us to do that. And coming from, back before the technologies that we had in the smartphones, we had to really kind of think about that stuff. Now there's a lot of new things that are available to us in with the mobile and the smartphones, but still, it really comes down to really simplifying stuff, right?
Yeah, in a lot of ways. Simplifying the message, trying to craft it around, not being totally subject to the delivery, but thinking a little bit about the delivery ahead of time.
Right.
And it even goes back to Mager's models for, media selection.
Sure.
So we just have new media to select from.
Right.
And we have new ways of doing things, especially when we factor in things like context. And how you can learn, location-based learning or point-and-shoot learning, kind of things that are just timely to the information you need right when you need it. Performance support, if you want to call it that. So a lot of that looks like the old lessons for performance support that are kind of being renewed because we have these new media to deal with that are even better at enabling the principles we knew worked back then. We had nothing to execute on for that location or context-aware learning.
Yeah, absolutely. So, we talked a little bit about healthcare this afternoon at lunch. You have a new book out. Why don't you tell us a little bit about how you got that?
It's called mHealth, From Smartphones to Smart Systems. And it just seemed like our portfolio of projects in the lab at UCF just started to, healthcare kind of sought us out for some of the mobile expertise. And all of a sudden I'm like, wow, 40% of our projects in our portfolio are healthcare related.
Wow.
We need to really focus on this and understand the differences in healthcare, but also build on the similarities of the things we learned from being in the mLearning space and looking at mobile performance for so long. But there's some nuances to it. New language that we've had to learn, some common elements of language, new understanding of security, especially with life or death situations or people's health records, things like that. That really changes the dynamics. So I've learned a whole lot through the process, and I'm eager to kind of merge those two worlds, mobile learning, mobile health, kind of coming together. And even if you're not in the healthcare field or someone's not in the healthcare field, it's still going to be valuable learning for them to take into their industry segment too.
Yeah, well, I mean, obviously everything that we learn in one thing is transferable over to something else. That's what we do, right? And you can observe and learn from one industry and then apply that to another. What are some of the take-home messages, some take-home lessons that you've learned from working with the healthcare industry that transfer over into other industries?
Yeah, so one of the things is there's this notion of evidence-based medicine. Everything is based on empirical evidence. And if you think about one of the things we really need to work on throughout the learning and HR space is measurement. How do we look at those performance measurements? And they're really serious about that because what they do is life or death.
It's critical.
So that's one of the things we can learn. The other is there's a lot of excitement around peripherals. And we all talk about apps. But what happens when we also have peripherals or accessories? And by their meaning, maybe something like the smart pens we use. But it might also be the digital cuff or the digital stethoscope that can automatically report information back to the doctor's phone securely.
Wow.
And then after the doctor has a chance to review it, it can then send it up into either the cloud or to an electronic health record that is, again, secure.
Really cool.
And you start to have this continuum that forms that is unlike anything that we've seen to date. And that's what I think a lot of doctors and forward thinkers in the healthcare space are really interested in. That passion around those topics came out a number of times in the book that we wrote and from the other expert authors that we had as contributors to this.
So that mobile device, that telephone or whatever it is no longer just standalone. It's connected to all this other technology.
Yeah.
So
yeah,
that's
exactly.
It's fantastic.
And you'll see that throughout the book. Just some of the poignant examples are where you can almost have like a clinic on a chip, and then that clinic on a chip is connected to the phone, which is your kind of communications hub, back out either the doctor who's looking at it right there, or back out to another larger healthcare system.
Yeah.
And if you can speed that up, you've saved the doctors, healthcare workers, a lot of time. And if you save them a lot of time, they can spend more time in the practice of medicine and less time fiddling with inputs of data and things like that too.
I think it's really a good example. My brother is a doctor, and and I'm like at a soccer game with me, and he gets a call, and it's important. He's never off work, right? These guys always need to be connected to their patients in some way or another, and that technology enables that, whether it's learning or patient care or some of those other supportive applications. So I think that's an important use case for mobile.
Yeah. And I think that there's still a lot of things that haven't been sorted out on all of these areas. Like, how do you pay for these things? What are the business models that work, most effectively? But I think we're getting there. And I think some of the things that you can also learn from mHealth are the way that the healthcare profession partners with government. It's a big part of what they do.
Yeah.
And it's a little less so in the mobile learning space, but I think we can draw some lessons from that because there's some good, effective models that spur innovation and spur on that, both efficiency, but also the seriousness of intent of these have to be right, these records have to be right, these, or people's lives or health could be at stake.
Yeah.
And that sense of seriousness comes across in a lot of what we see in the healthcare space.
Excellent. Well, it's a fantastic space to be working in. It's very inspiring, lots of fun. So what else have you seen recently that you're kind of excited about, that you're kind of jazzed about?
That's a big question. I just got back from South by Southwest, and I got to see a lot of stuff.
I'm kind of jealous about that.
yeah, we had a really good time. Right. So some of the things that we saw just in general groupings, saw some new augmented reality tools for mobile that were kind of cool too, and something I've been talking about for a long time with like point and shoot learning is now becoming much more possible with some of these technologies. You just take a picture of something, it automatically does a visual search and gives you back information or
That's
data.
Amazing stuff.
So point and shoot, so it's finally here, is one of the things, and real technology that works across multiple platforms. Yeah. So that was exciting. The other thing that was exciting was sort of like the conference that we're at now. Wouldn't it be nice if every person had a little bubble over the head that told you what some of their interests were? Or if you had something location-based to see that you were, 3 meters away from someone who was also interested in mobile learning and healthcare. Right. Just to be able to have those, like the breakfast birds of a feather sessions, but all throughout the day.
That's
and
awesome.
Extemporaneously. Just, it's kind of that informal learning taken to a new level because of location, context, and maybe your profile of interest or your role. Any of those things could be triggers that we probably walk past people in this conference 10 times a day that have the same interests that you or I do, and we don't even know it. But now with tools like, GroupMe, Banjo, Sonar, Highlight, there's a whole bunch of them. We don't know which one's going to win necessarily, but just exploring some of those and seeing if they fit within your organizations, I think that's going to change the dynamic, especially when you have group settings where people are coming together for a community of practice or a conference like this where everybody has an overarching similar interest, but then there's sub-interests below that are hard to sometimes identify or get people's groupings around.
I love that stuff, and one of the cool things about it is we talk about this stuff, right? And the speed in which mobile is moving, technology is moving right now, it's not that far out. It's happening now, and those ideas that float around this year might be actual reality next year. That's one of the cool things about the speed at which things are moving. So
yeah, and it's I think it's already here in a lot of ways too. You know, I think I got to see Ray Kurzweil. I think it's one of his quotes that he says, "The future is here. It's just not equally distributed." Right?
I love that. Yeah.
So you get to see some of these things in pockets, but they haven't maybe made it out into the popular mass of early adopters. They're just in the core innovators' hands, and they'll start to spread even to the laggards of technology too, because sometimes the technology is transparent too, and that's what I love seeing too, is all these technologies that you don't have to be a technologist to appreciate.
Right.
And when we see doctors, smart people, but don't necessarily care about technology,
they're not focused
doing
on
this
and
using it, and they're the ones driving the ship. It's not being forced upon them.
Right.
That's an exciting time.
It is. It is. That's very exciting.
That's a change. That's a human change, a change management issue that is working in our favor for once.
Yeah, absolutely. We were talking about that earlier, how this is all being driven by what's available, right? We're adopting things that are already happening in this space, in this technology. We're implementing them instead of inventing them because we have a need. It's already there. It's just take advantage of it. So that's exciting.
Yeah.
So, well, great, man. It's good talking to you,
too.
and I really appreciate you sitting down and looking forward to some of the great stuff you continue to do. Keep us posted, will you?
Yeah, you too.
All right.
Thanks. Appreciate it.
Thank you, man.
Bye.